All right, so we're ready to get started and we're happy that you're here. We're going to start a little bit different this time. All right, so how many of you right now are feeling like you're on a 1 on that scale of 1 to 5 that we like to talk about? You're 1, meaning that, you know what, sometimes it's hard to get started in the morning. Sometimes it's a struggle to come up with innovative, creative teaching strategies. Well, you are not alone. So many of us struggle with keeping our students connected to the content that we're sharing with them. All right, so first we're going to start by sharing a reflective moment, a devotional that we want you to take a listen to. All right, and so what we're going to do is start from the very beginning. Some of you saw this one if you saw our last snapshot. Faith is taking the first step even when you don't see the whole staircase. Dr. Martin Luther King Jr. And now we want to help you focus on a reflective moment because I know we don't get these a lot. Here's your daily motivation. The path of a nurse educator is one of continuous growth. Each step you take builds not only your skills, but also your impact on those that you teach. Trust the process even when it feels uncertain. So today, we want you to take action, reflect on your purpose as a nurse educator, write down 3 reasons why you chose this path and how you can positively impact your students. All right, so we want you to take just a few seconds to engage with us on a reflective moment and to think about your why. We often ask our students to write down their why. How often do we take the time to write down our why? When you're on this journey to achieve nurse educator excellence, it can be challenging at times. Know that you don't have to do it alone. We're here to support you, to guide you, to inspire you to keep going, to provide a sense of resiliency within you to help you stay focused on your journey, whether it's to get better as a nurse educator, get better as a nurse, or to achieve certification as a nurse educator. You can achieve your CNE. The only way you won't achieve that passing score is if you quit, okay? So welcome back, everybody, to Dr. Sellars Educate, where our mission is simple. It is to support all nurse educator colleagues on the journey to achieve success on the CNE exam. All right, so if you haven't already, go ahead and print out your study worksheet. If you've joined us before, you know the steps you have to take. Print out the study worksheet, and we want you to write down today's date, what your priority is for today. Knowing we're going to be focusing on the 3 learning domains that's part of our series. Last session, we focused on cognitive learning domain. So if you didn't check out that snapshot, go back and watch that one. And this session, we're going to focus on the affective learning domain because we know that one can be a bit of a challenge for many colleagues. And so that's what we're going to focus on, looking at specifically the definitions, verbs, and assignments is what we want you to think about related to the affective learning domain. Okay, so some of this is going to be reflective practice where you're going back and you're looking at where does affective learning domain evaluation show up in your curriculum, in your exams, in the assessments that you're doing with your students. And then the second part is once you identify where those experiences have already been integrated, maybe there's some opportunities. Maybe you struggle with finding them, and that's okay, right? This is about a journey of discovering how to become a better nurse educator. Our thought-provoking question for this session is a scenario. So during a clinical rotation, a nursing student expresses frustration with a client or a patient who refuses their medication. The student says, I don't understand why I have to waste time explaining this over and over when they're just being non-compliant. In addressing this situation, which teaching strategy best promotes growth in the affective domain? A, ask the student to share their thoughts during the post-clinical conference to allow for more discussion. B, assigning a reading on the pharmacokinetics of the medication. Or C, guiding the student to reflect on the patient's perspective and explore empathy for diverse health beliefs. Each time you get to a question on the CNE exam, the first thought should be, what is this question really asking me? Second of all, what is it that I know for sure about concepts related to this question? So take a second, Write down what you think the correct answer is. Okay, and this is what we want you to think about. What is attracting you to what you think is the correct answer? Going deeper and understanding your why. Why is it that you're choosing that option as the correct answer? The second consideration is identifying for those distractors. How did you discern that those other two choices were not correct? Okay, so understanding your why is going to also help you achieve that passing score on the C&E exam. All right, and stay to the end so you can find out what the correct answer was. When we think about affective learning domain, what we know is that colleagues often struggle with this concept. And so what we're going to focus on today is a little bit of a different take. We're going to use a reference or a resource that is on the website that we think is very good, right? So there's no need to reinvent the wheel, and it's published by Vector Learning. All right, so when you go to this website, you will find this wonderful pyramid. We're going to develop one similar, but we want to go ahead and share what Vector Solutions has for all of us to review on the website. First step you want to take is understanding the definition. So what is the definition of the affective learning domain? We're going to go back and look at that in a second, but I wanted to go ahead and bring you to this website because I think this model is excellent. So the second consideration is what learning or what behaviors are being demonstrated at each level, because remember, Bloom's taxonomy for all three learning domains says we may start at the bottom, but we've got to build on our prior knowledge until we get to the top. So at the receiving level for the affective learning domain, learner is willing to pay attention and listen with respect. But look at what happens at the highest level. They develop this value system. It becomes who they are, what they do, and how they think naturally, right? Because they've been molded and shaped based on prior learning, based on prior feedback that we've given them about their behaviors, about their thoughts, and most importantly, how it influences their patient care decisions. Okay, so we're going to put this link in the chat, but we encourage you to go here to take a deeper look at what Vector Solutions has already published for the public to take a deeper look at, because we feel like it's a very valuable resource. Okay, not all resources we know are aligned with evidence-based practice, but we found that this specific one was. So what is this learning domain all about? Well, it says that this learning journey that we take students on related to their knowledge, skills, and attitudes for the affective learning domain helps them make decisions about the compassionate behaviors and the ethical decision-making process that they're going to engage in when they're having interactions with patients and with families. So again, affective learning domain, our ability to truly engage with our students, partner with our students to help them develop in this learning domain is a really important step, because we know it is critical for our students to demonstrate caring, compassionate behaviors when they're delivering patient care. It requires reflection and role modeling. So it's not enough just for us to tell the students about the patient care decisions they should make. We have to role model that, right? Even in our didactic setting, we want to be an active listener. We want to engage students in discussions and dialogue where they feel like what they think, what they believe is important, right? Remember, we may start on that lowest level, but we scaffold. That lowest level again is receiving, right? But we don't want students to stay there because they do come in with their own beliefs and opinions about what patient care should look like and how involved a patient and family should be. And we want to make sure, and as we move them through the continuum of learning with the affective learning domain, that it aligns with evidence-based practices and the compassionate care we expect our students to deliver. What else is it that you need to know? Well, know that the affective learning domain is best taught through faculty modeling, storytelling, and opportunities for self-reflection, making sure that we're taking the time to debrief with our students, to engage in that post-clinical conference. Even during our simulation, we know debrief is critical. Us making sure that we have connected the dots for our students and with our students. We are nurses. We have been at some point in our nursing career at the bedside. Our ability to really connect in a meaningful way with our students about what they may be experiencing is a very impactful conversation and discussion to engage in with our students. We can also tap into students' prior learning experiences. So asking them to talk about the patient care experiences that they have had as well. An example would be a nurse educator sharing a personal clinical story about advocating for a vulnerable patient, then prompting students to journal about how they would handle a similar situation. All right, so when you're thinking about how we're engaging students across all three learning domains, it's really important for us, first of all, to have a deep understanding of the definition of that learning domain. Second of all, how are we integrating evidence-based teaching strategies to ensure our students are actually learning? And then third of all, how are we demonstrating? How is it coming to life? How are we bringing to life the curricular elements that are essential for our students to make safe patient care decisions? It is a journey where we're constantly coaching, mentoring, giving students feedback in a way that they're able to truly grasp deep comprehension of these concepts, specifically with affective learning domain, to that highest level where students are actually changing their beliefs, right? And truly being responsible for their behaviors and the decisions that they are making when it comes to patient care, not engaging in making judgment decisions about patients, right? Going back to our thought-provoking question, which we'll wrap up with, but making sure that they are making decisions that are in the best interest of the patient and that their care delivery practices are aligning with that, right? Making sure that we're not focusing on what our beliefs are, but what is in the best interest, again, for that patient to help them recover and return to a state of health, prior health, or even improving their health. So if you chose for the thought-provoking question, option C, you are correct. Give yourselves a round of applause. Guiding the student to reflect on the patient's perspective, right? So meeting the patient where they are, because we don't know the patient's story. We only know what they tell us, first of all. And second of all, it's not our business to know the why. What we have to focus on is the what. What is it that we need to do to help decrease our patients' frustration or even disappointment sometimes in where they are with their health, and focusing on our part, the role that we can play to help, again, support our patients to return to a state of health or to improve their health. A is not correct because, yes, we can certainly do a debrief during a post-clinical conference. We want to give that formative feedback right away, right? Guiding is an important teaching strategy for us to utilize to support the development and really the scaffolding of that affective learning domain. Assigning a reading, that's passive learning. So yes, from a cognitive standpoint, we can ask students to engage in this practice. However, we know that this is not most closely aligned with the affective learning domain. Okay, so again, step number one, when you get to every question on the CNE exam, ask yourself, what is this question truly asking me? And second of all, what is it that I know for sure about content and concepts included in that question? We hope that this snapshot has been helpful. Make sure you go back, fill out your study worksheet, see how close you got to achieving your objective for showing up today, and make sure you're taking a look and using Billings and Halstead. We're still using the sixth edition, even though the seventh edition is available. You're going to look at pages 188 through 190 as we continue to go deeper in understanding the learning domains that we know are essential to support the learning journey. We look forward to seeing you in our next snapshot and hopefully in our boot camp, where you can earn 1 contact hour every single time we have a monthly boot camp, which happens 2 times a month. All right. Reach out if you have questions. Info at drsellarseducate.com. We look forward to seeing you next time. Have a great one, everybody.